And as we started to go from medicinal use into legalization in California, that's when I started getting more involved in the policy side of things. Because prior to that, and actually the reason that I ended up having a great relationship with the executive director of the dispensary that I worked with for 10 years was writing letters to the Department of Public Health about products that were available and why there was a lack of accessibility to certain products that could be helpful for patients. So I became the co-chair of the legalization task force for San Francisco, and I did that for several years. And then I was on the cannabis oversight committee for San Francisco, representing medical patients and also compassion programs. I ran a compassion program for many years, giving free donated cannabis to critically chronically ill community members that were low income. And today I sit on the California Cannabis Advisory Committee, where I am the chair of the Medicinal Use Subcommittee. So I travel throughout the United States lecturing about cannabis policy, cannabis being used as medicine for doctors, nurses, healthcare providers. I do trainings for dispensaries and cannabis companies, from train the trainer to full on staff trainings. I've taught at City College, I've lectured at Kaiser, UCSF, and also UC Berkeley, a Haas Business School. I've had the pleasure of lecturing at. But really, like, creating more conversations. I always say conversation is normalization, creating more conversations to activate the public, because part of having good policy is changing hearts and minds and also letting people know that they have a voice. Because when we look at policy here in the United States, it's not necessarily based on fact, it's based on stigma and also state culture. Because even though we're one big country, all of our states have very individual cultures and identities, and you can see that reflected in their policies. So when we look at, what's going on